my name's Hillary. I'll be your student nurse practitioner today. We're going to go over a head-to-toe assessment with you. If at any point you're having any pain, tenderness, or you don't quite understand, just stop me and we'll see what we can do, okay? Get my hands washed. Take a look at your skin. Good. Take a look at your eyes. If you'll just look straight ahead, you can blink if you need to. Same thing, you can blink if you need to. We would check your vision with the Snellen chart at 20 feet. We would also test for corneal reflex. If you'll watch my finger and just follow it with your eyes. Okay. And if you'll look at that sign above me and then right back at my finger. And then the sign on this side and right back at my finger. Very good. Any pressure here? Any pressure here? Look at your ears. Any tenderness here? Tenderness here? Look in your nose. Okay. Yeah, go ahead and open your mouth and say ah.
Ah.
Very good. I would also elicit the gag reflex here. All right. Can you smile for me? Can you frown? Can you raise your eyebrows? Can you puff your cheeks out? Very good. Let me see your tongue. And can you move it? Very good. And go side to side. Very good. And bend your head down just a little bit. All right, and swallow for me. Very good. All right, can you push against my hand? Push against my hand. And can you turn your head to that way and then back to this way? All right, very good. All right. Got something for you to smell. I want you to close your eyes and tell me what you smell.
Peppermint.
Very good. All right, I want you to close one nostril for me. Can you smell it? Okay, and then close the other nostril. Can you smell it? Very good. With your eyes still closed, I have a cotton ball. I'm going to touch you at different places on your face. You just tell me if you can feel it, okay? All right. With your eyes still closed, I've got something that I'm going to have you feel for touch. You just tell me if it's sharp or dull, okay?
Sharp, dull, sharp, dull.
Okay, very good. All right. If you'll close this ear for me, I'm going to whisper. You tell me what I'm whispering.
ABC.
Okay, and the other ear?
1, 2, 3.
Very good. All right, we're going to test your hearing, okay? You just tell me if you can hear it equally in both ears. Okay. Now you're going to tell me when you quit hearing it, okay? Okay, very good. All right. Now I'm going to listen to your lungs. All right, I'm going to have you turn your body that way just so the camera can see us. All right, now as I listen, I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Now I want you to say E.
E. E. E. E. E. E. E. E. E. E.
And how can you whisper 1, 2, 3? All right, I want you to say 99 for me.
99. 99. 99. 99.
Okay, take a good deep breath in for me. And let out. Very good. All right, take another deep breath in for me. All right, now exhale. Good. Say 99 for me.
99.
Very good. Just listen regular now. Very good. Regular rate and rhythm, and his inspiratory is longer than his expiratory. Now I'm going to listen to your heart. Go ahead and listen for your carotid arteries. Your pen right down here. Very good. While I've got you sitting up before you lay down, I'm going to check you for any tenderness back here. Any tenderness? Okay. Go ahead and let you lean up there. Just taking a look at your neck. Very good. And listen to your belly first. In this position, I can also palpate the femoral pulses, palpate any femoral nodes or inguinal nodes. All right, now I'm going to just palpate. You let me know if it's tender, okay? Any tenderness? Any tenderness? Okay. A little bit deeper. Any pain? Okay. Good. Palpate your spleen back here. Any pain? For your kidney? Any pain? On this side? Any pain? Okay. Very good. All right. You can go ahead and sit back up for me. All right, I'm going to just listen to feel your pulses. Pulses behind your knees. You can relax them. All right, very good. I'm going to check your reflexes. Just relax that down. Okay. All right. Arm up like that. Just relax it. Just relax it. Okay. Relax it. Before we test your range of motion, the one thing I did forget when we were doing your lungs was percussing your lungs up in the front. So I'm just going to percuss in between each. Very good. So now we're going to test your range of motion. We're going to do this arm and this leg. So we'll start here. Any tenderness, right? decrepitness. Very good. All right, so can you extend? And then pull to you. And then can you put your hand up like this and then across? All right. Now I'm gonna do it for you. Just relax. Very good. All right, and same thing for this here. Go ahead and turn. Any pain at all? All right. Can you go all the way out? And then back down. Do it one more time. Okay. All right. Now I'm gonna let me do it. You just relax. All right, very good. And I'm just thinking to make sure I did not forget anything, and I think we are good. Thank you so much. So with this being a male patient, I would assess the prostate. By doing so, I would have the patient turn over across the bed. I would use not a sterile glove, but a lubricated glove to test for any abnormalities on the surface of the prostate. I would also assess the patient's penis, testing for palpating the testicles, making sure there's no abnormalities there. I would also do the cremastic reflex as well, and of course with that we did not do that today. If it was a female patient, I would look at the vagina, just assessing for any abnormalities, any lesions, any rashes. I would palpate for any masses. I would also separate the labia so that I could look for the urethra to see if there was any discharge as well. And then for the breast exam, I would have the patient lie down. I would look at the breast with the patient sitting up and with the patient lying down. I would have the patient put her arm behind her head and palpate the breast in a circular motion. I would also look at the areola, making sure there was no abnormal discharge there. I would also make sure I palpated the tail of Spence. Of course, today with this patient, I did most everything above the clothes, but if it was in clinic, I would make sure the patient had a gown on and would be actually listening to heart, lungs, underneath clothes, straight on the body. I would also listen to the heart with the patient lying supine and with the patient lying supine and in the side position, the lateral position. And that concludes the health head to toe assessment. Thank you so much.